So, hello to the team at Glasgow Caledonian University. My name is Sarah J. McInerney, and this is my pre-recorded interview. And so, for your first question, what three things do I think make a physiotherapist both effective and good at what they do? And for me, it has to be adaptability, perseverance, and empathy. So, perseverance is one of the key skills of a healthcare professional, both within yourself as well as the relationships you build with patients. Showing up day in, day out is going to translate into good patient-therapist relationship. And as we know, progression is never linear and it never goes the way we want it to. And so having that key skill of perseverance within yourself to allow yourself to show up, to work with that patient and ready to do what you need to do is really going to translate into good patient care as well as good patient outcomes. Adaptability is one of the other key skills. You can take the best treatment protocols, the best modalities, you can have access to world-class healthcare. But if you're not able to take what you know and mould it to fit exactly what that patient needs, you're not going to be as effective in your care as you could be. And while both adaptability and perseverance are key, it's empathy that really drives the relationship. So we only see a patient for a fraction of an hour for maybe once a week. And it is difficult to bond in that really limited amount of time that we have. But just taking the time to really hear the patient and truly listen to what their concerns are, makes the difference in a good and a great physio. Patient psychology is so linked to injury, as we know from the biopsychosocial model, as well as the pain catastrophizing models. And we as therapists are in a really unique position to hear the patient's problems and communicate solutions. And so following on from that, I am going to tell you a case that hopefully shows that I have these three qualities. So it is a case that I was really fortunate to work on last year. It is a youth academy winger who, on his debut try, managed to break 4 out of 5 metatarsals, and as the pitch side medic at the time, I picked him up, I handed him off to his dad. He went to hospital and it was confirmed that he had 4 out of 5 fractures. Now that's never an easy thing to tell somebody, and to start, what we really did was just sit down and hear what he needed to say. He had so many concerns, he was on the brink of a professional contract, and that was all thrown into jeopardy. And so we sat and we listened. And what we tried to do was fix the little things now. And so that was his school and his home life. And so his school life, we got him accommodations, it meant that he wasn't going upstairs, he was able to use elevators. We changed his bedroom from upstairs to downstairs as well. And we just made the little things, the little changes. And then that really showed, actually, these guys are out to help me. And it allowed him to come into physiotherapy ready to work. And we could really push on not having those concerns outside of physio. And from there, we were really able to drive on, having those little foundations of a relationship. We did take the consultant's report and we did look at it, and we fairly swiftly realised that this is not going to be for him. And, we really made him a scholar of the game. We knew from what we had encountered before with him that we could really push this boy. And so we worked on all the little niggles that he had never had time to address previously. We worked on his biomechanics. We changed all the little things, which really meant when it was time to do the hard graft on the metatarsals, we were able to push on. And then we knew when he was having a bad day that we could maybe regress it a little bit, take it easy. And then when we knew he was having a good day, we were able to push on. And then, our perseverance. So we could nearly set our clock by the time that he would pop into the physio room. But as therapists, we made it a point to be there for 5 minutes before and 5 minutes after. We'd just sit there. He'd be able to stick his head in, say hi, and then run off to the gym, or he'd be able to sit there and talk about the problems of the world with us. You can nearly set your clock by it. And yeah, so just showing that we were going to be there every single day, no matter what mood he was in, we were always going to be ready to work with him. And I think that really shows, in his patient care. And I'm very happy to say 4 or 5 months out of after the injury, he was back playing again, and I'm very happy to say he has a professional contract now. And for your third question, so what experience do I have working with people from other backgrounds? And my experience in healthcare has been limited, I would say, and I haven't got the opportunities that I would like to work in disadvantaged areas as much as I would have. But I'm going to tell you about a case that hopefully shows, my experience, and I've learned something from my approach to healthcare. And so this is the case, and it's shared with permission. This is the case of Martin, who is a patient I'm working with in a community health programme. He is a HSP patient, so he has hereditary spinal paraplegia, and that effectively means that the muscles in his lower body are constantly in spasm, as well as a host of other problems associated with memory, walking, all the like. And I was assigned his case on the first day I walked into the programme, and I walked up to him and I introduced myself. Hi, I'm Sarah, I'm your medic. And I was very swiftly told, you're going to do what I say, you're going to do how I say it to you, and you're not going to ask questions. And I was rather taken aback. And frankly, I thought, well, if this boy's going to be rude, I am not going to work with him. And I was very indignant, and I brushed him off and whatever. And then as we progressed through the session, we worked together, and I kind of went home and I reflected a little bit onto, well, why? Was it something I said? Was I rude? Did I not have an approachable manner? And upon further reflection, from what I had heard from Martin during that day, Martin's experience of the healthcare system hasn't been my experience. So I wear glasses, and I've obviously been to GP checkups and dentist appointments over the years. And every time I brought a concern, it was addressed. I was believed. Every concern I brought up to the doctor, the optometrist, a solution was communicated to me. But Martin had fought for so long, because HSP is such a rare condition, he had fought just to have his symptoms heard. People thought when he was younger, he's just clumsy. He's not one for the sports teams. Maybe he'd be better just sitting out. And it wasn't him. It was his condition. And so I kind of realised healthcare had been so bad to Martin. They had invalidated his concerns, and every healthcare professional that had gone up to him, he had felt the need to advocate for himself so strongly that when he advocated to me, I was taken aback. And, without further reflection, it'd be so easy for a healthcare professional to just say, well, I'm not going to work with him. And, on looking back, I had kind of approached Martin is my HSP patient. Martin is this. No, Martin's a taxi driver. He's 65 years old. He has 2 daughters, one of which is also called Sarah. And he loves Thin Lizzy, which is a great 80s throwback if you know it. But I had seen Martin as the sum total of his condition. Martin is so many other things. And we as healthcare professionals are there just to support him, listen to his concerns and communicate solutions, rather than try and dictate our own feelings, our own protocols, our own treatments onto him. We're there to work with them, not be in charge of them. And so I think what I really learned, and I'm not going to chart the future because I can't, but hopefully when I approach patients, I'm going to listen to them as a holistic person. Does Martin want to go out and dance on a Saturday night? Is that his goal? Or is his goal just to walk? Or is his goal to run a marathon? One of Martin's goals is actually to hula hoop into our centre. So that's what we're working on at the moment. But I hope that shows, my approach. I did go about it the wrong way, but I've learned something from it. And that's my approach to physiotherapy in total. Hopefully I just can keep learning. And so for the final question, tell me about a difficult situation. I have been incredibly privileged in my life to not experience a whole lot of hardship, and I recognise that. But I'm hopefully going to tell you something that really represents who I am. So for the final 6 months of 2022, I was on an unpaid internship over in the UK. And as part of my internship, I was working in a multidisciplinary team with sports rehabilitators, physiotherapists, physicians. And, it was amazing. It was a huge learning curve, and I'd never experienced anything like it as a therapist or as a person. And so I'd worked so hard to get into the programme, and I was continuously working in the programme that I was waking up, going to the programme, coming home, sleeping, maybe having dinner, and then waking up and repeating it all over again. And I realised I wasn't being true to myself. My mental health was suffering massively, and it just wasn't working for me. While I was learning so much as a therapist, I was stagnating as a person. And so I realised I had done this cycle over and over and over again. So I am a 4-time national champion. I have titles in European competitions. I have a European ranking. And all of it was to make other people happy. And so I had done the same cycle over and over again through sport, through school, through even college as well. And I realised I needed to take a step back. So I did. I stepped back from the programme. I travelled for a few months. I learned who I am, what I like, and I learned that I need to be a little bit selfish. And so hence my application to Glasgow Caledonian University. This is an entirely selfish application. It's entirely for me, and it's entirely what I want to do next. So my future goals include working in community healthcare interventions like I'm doing at the moment, but specifically in youth populations to try and stop the injuries and stop the conditions before they happen. And that's my application. So I look forward to hearing from you. Thank you so much for your time and for your consideration, and I wish you the very best of luck.